we definitely don't want you to poke the bear. There's no need for that. If you're irritated in your knees, your hip joint, then why stay in that pain cycle? Do what's needed to get the job done. And like Coach said, there's people that are like, oh man, well I could do 3 squats, 4 squats, but man, I can't sleep at night. My TFL wakes me up, and it's just like, well, yeah, you're probably not ready for that yet. Coach Raul.
How you doing, man?
Good, how are you?
Good. Hey, great job today on the coaching calls. So today, Thursday, we had Coach Jay present for the Knee Arthritis Recovery group and for the Hip Arthritis Recovery group.
Yes, sir.
Later in the day. And the topic that he touched on was the phase 2 of the Knee and the Hip Arthritis Recovery Program.
Yes, sir.
So really good topic, actually. So can you tell us a little bit more about what you spoke about today?
Yes. So last week you talked about the greatest hits from phase 1. Mm-hmm. And so we have a bunch of new people. Welcome, by the way. So phase 2, I feel, is also very important. It's my favorite phase from the programs. Yeah. It's where you're learning to use the proper muscles. Mm-hmm. So it's not so much about strengthening at this point. Hopefully during phase 1, you've calmed down your symptoms of your arthritis. So now you're really ready to kind of segue into that activation portion, right? Just learning how to turn on those muscles. So today we talked about the activation, the hourly exercises that everybody's like, what? And then we also talked about not worrying about strengthening, but activating, just flipping the light switch on those muscles that need to get strong.
Yeah, that was a very interesting topic, and I guess one of the things that I really liked seeing was all the new faces learning about these concepts, and it's always kind of fun and not fun at the same time, seeing how someone can be overwhelmed by the task at hand, which is doing things in an hourly basis. But there was a really good question that came up on the program, and I think this is partly from a comment that I read on YouTube. One of the things that this person was talking about was what to do when you have so much pain that every single movement actually makes you flare up. And just for context, everyone here, in our recovery programs, we have 4 phases. We talked about this a little bit last time, but in the very first phase of the program, we dedicate ourselves to not be irritated so that you can actually exercise. And then you have phase 2, which is where you arguably correct the muscle imbalance. And then phase 3, where you just try to build up some muscle, some endurance, and then phase 4, where you maintain.
Yes.
So this person would qualify for a phase 1 because she's hurting with every single little thing. But that got me thinking, because there are some cases out there where even a very small motion, even a passive motion, can cause pain. Yeah. So this got me to think this is something that we can talk about, because we can give people strategies on what to do.
Right.
So I guess I'll start with one of the things that all of our viewers might be familiar with. So you have the YouTube channel, if you're watching us on YouTube, where Dr. David will put out 3 or 4 exercises that you can do to fix, or maybe fix is not the right word, but to control your pain when you have hip arthritis or knee arthritis. And you'll find your outliers that cannot do any of these exercises reliably without hurting themselves. So there's a couple ways that you can go about this. One is that you can minimize the range of motion as much as possible.
Yes.
Which means if you're supposed to wiggle your thighs this much when you're doing the thigh fidgeting exercise, just wiggle them a little bit less. It might sound very simplistic and even reductionist to a point, but that can actually fix some of the problem, because you're moving the joint a little bit less and you're not incurring into irritation. There's a possibility here, which is the solution number 2. There's massage guns out there. Yeah. There's massage tools that you can use. And using these things proactively, not just when you're hurting, can actually help you with that sensation of tightness and pain.
That is, I loved how you put that into context. I think when people open the program, right, they've probably seen Dr. David on YouTube already, and he's kind of giving them a little bit of the keys, some of the secret sauce. Yeah. And then they get the program and they open and they see phase 1, and they're like, what? That's it? And it's like, yeah, that's it, right? It's sometimes it's the most simple task that really help to boost confidence, make movement feel safer, and give your body the sensation of I'm okay, right? Because if you're dealing with your symptoms of a hip or knee arthritis, you're probably in constant pain. Standing up hurts. Sitting down, like most people have trouble, even they fear going to the restroom for the sake of having to sit down. Most people have older homes with plenty of stairs. And so day to day seems like it's already nothing. And then you get to the program, you're like, oh man, like this is it. But like Coach said here, even just doing the simple minor movements and combining that with massage therapy, in this case, a massage gun, which pays for itself. It's such an underutilized tool, and it can offer you the biggest payback.
Yeah. Oh my God, you said something right now that resonated with me right away. I find that sometimes, because of how simplistic the phase one might seem, in terms of how much exercise you're supposed to do, that people might have this sensation that they're not doing enough to recover from their hip or knee arthritis.
Yeah.
But what I will say is that in phase one, you're probably going to benefit more from the things that you do not do than from actually doing more. And this sounds counterintuitive, but I'll give you an example. Like there's people that will be working through this program through their first phase, and they will be doing a lot of physical activity outside of the treatments.
There you go.
And because the treatment is done at home, it's done in the comfort of where you are. They feel like they need to do some extra. They will think, well, I need to complement this with swimming. I need to complement this with walking or going to the gym and lifting weights. Activities that are awesome, they're great. You actually should do them. You actually should be lifting weights. Just to clarify, we actually promote for people to lift weights. We want you guys lifting weights. We want you deadlifting, doing squats and everything else, but not when you're very irritated, because you're just not going to reap the benefit.
Time and place.
Exactly. You're just not going to get to the... If you're very irritated in your hip and doing 3 or 4 squats hurts, then you're not going to be able to accumulate the amount of workload or volume that you need to actually benefit from it before you hurt. That being said, I find that as a coach, helping people pull back a little bit from these activities just for a few weeks actually helps them get through that first phase and then move on and get to the parts that they want to be doing in the program.
Man, I heard that so much today. So I would say this is some of the newer people that were able to get in on the program. This is probably their second, third week. And the first week, their question was, when can I get back to these activities? And so week 3, they're like, I feel so much better because I haven't been doing those activities. But like Coach said, we're power lifters, man. We want you guys lifting weights. That's just like the meathead in us. But we definitely don't want you to poke the bear. There's no need for that. If you're irritated in your knees, your hip joints, then why stay in that pain cycle? Do what's needed to get the job done. And like Coach said, there's people that are like, oh man, well I can do 3 squats, 4 squats, but man, I can't sleep at night. My TFL wakes me up, and it's just like, well, yeah, you're probably not ready for that yet. But if you do the things that you need to do, offloading, massage, and those gentle movement patterns, I promise you'll be able to do 20, 30, 40, 50 squats when it really matters, and you can truly reap the benefits of those exercises.
Yeah, it's a concept of diminishing returns.
Yes.
I had this conversation with one of our members. He was talking about walking, which I think is a very good activity to do in terms of general health. And in the spectrum of strength training, if you're someone who was recently coming out of, if you were disabled in some way and now you can actually walk again, then it's going to be a strenuous enough activity to be considered like a strength movement to a degree. No, it's not quite a strength movement, but it can be very beneficial. The point being is that if you're very limited in how much you can walk because you hurt after 1,000 or 2,000 steps, then the return is very small on the large investment that you made in terms of pain and irritation. So when someone's in a lot of pain, I say, hey, I get you. I hear you. I empathize with what you're feeling. I know that it's terrible, and it must not feel good to feel confined in your home and not be able to exercise.
Yep.
However, if you want to get out of this stage where you're so irritated that you cannot do exercises, that you cannot get back to the activities that you love, then the fastest way for you to get there is to not mess with your knee or your hip right now. So the piece of advice, I guess, here is to look at the data, or look at your trends in the sense of identify what triggers your pain. Identify what triggers. What is it? Is it what I do, or is it how much I'm doing?
There you go.
That's a really good question to ask yourself, and then you go from there. Okay, I noticed that walking doesn't hurt if I just walk to the store, or if I clean my kitchen, but walking if I walk my dogs, that hurts.
Yeah.
Okay, so put things in a balance, and just for the time being, just for now, consider reducing those activities.
I think that's a great way to put it, is take notes. Keep notes. Keep a notebook. I'm an old school guy. I still keep all my training like on a notebook. The cell phones now have like notes, like apps, or like a section where you could just type stuff down. I'd really keep track of that, so that way you can start to build the know of what you can do. Like we used to have Miss Kathy Fox, right?
Oh,
and
yeah.
She wanted to clean her floorboards.
Yeah.
It's something simple as that, but it would irritate her knees and her hips. And so, some of these things do need to be done, but that's where you can easily find a nice little grabber tool with a Clorox wipe and scrub it. You just kind of have to find things that don't irritate you, but they still satisfy you. And I promise, it will kind of ease your mind. You have to be okay with stepping back from some things, but keeping data is huge. See how long you can stand on your feet. A lot of people that started off, they were like, Jay, I can't even spend 10 minutes to cook my meal. And a couple of sessions later, a couple of calls later, they're like, you know what? I cooked an hour-long feast, Me and my husband ate well. So it does kind of, you have to practice self-restraint, right?
Yeah.
But having the data, having the numbers so you can look at it, it's tangible. Yeah. That helps so much than just kind of spinning your wheels up top.
Yeah. Consider this. When you go to the doctor and you start taking a medication, the doctor will often tell you or ask you to refrain from certain things.
Yeah.
Like if you're, I don't know, like if you're taking aspirin, or like a blood thinner, they'll tell you not to do this activity or do this thing. And you usually listen. Most people usually do, because everyone's afraid of hurting themselves more. And that way you can actually see, you're trimming the fat in essence, and you're only taking what's effective in a way. So if you're doing treatments for yourself, and it doesn't have to be specifically about this program, but if you're currently seeing a physical therapist or undergoing any type of treatment, it's best if you trim the fat and take away activities that make you hurt or that set you back. And for the purposes of phase one, I'm serious. Like the less you do of the other stuff, the faster you get back to what you actually want to do.
Correct.
And I know that we're talking about very few activities, but you can actually help yourself a lot when you are hurting. When a lot of things hurt, consider reducing instead of adding.
Yeah. I love how you put that. It's not that you're stopping all activity. You're not going to be bedridden. Just stop the extra stuff. If you are on the knee arthritis or hip arthritis recovery program, it's built in phases. And if you do find yourself kind of going through the YouTube videos and you're trying some stuff and it's working a little bit, then maybe consider getting more structured help. There's a coach for everything nowadays.
Yeah. Oh, yeah.
Life coach, relationship coach, whatever. I think that if you can even become that coach for yourself, understanding what's causing the pain, what's keeping you in that pain cycle, minimizing that, and doing enough of the other stuff, you're still going to be active. You're still going to be doing some things, but you're not going to be feeding into that pain cycle that's just keeping you down. And you have high days and you have low days. We want to see more high days, but how you get there is calming down a little bit, doing what you need to do, so that way you can do what you want to do.
Yeah. So I want to leave you guys with a few actionable items if you're watching us on YouTube before we wrap up this call. So number one is consider using crutches, a cane, or a walker if you're in a lot of pain.
Offload.
Second one, massage yourself a little bit. You can look at the data, you can look at the research and whatnot. What we've seen from our personal experience as coaches here, anecdotally speaking, is that it actually does help a lot. So massages, minute to a couple minutes, consider massaging the quads. Number three, avoid irritating yourself any further with any activities that you know that hurt. And number four is find one of our pain control exercises. If your knees hurt, your ankles hurt, your hip hurt, do these pain control exercises and don't dive into strengthening just yet, and do it very gently. But that's all I have for today's
that was a good
podcast.
talk, man.
So, Coach Jay,